In 2026, the healthcare landscape has undergone a radical evolution. We have shifted from a reactive system to a proactive reality powered by always-on, tech-enabled monitoring. Fueling this massive transformation is an elite class of unicorns like Oura, Levels, Hinge Health, and Ro. They have democratized access by moving clinical-grade diagnostics from sterile labs into our daily lives. This video explores how these innovators are doing far more than just selling devices. They are radically altering societal behavior, shifting control back to the individual. They are setting a new, higher standard for how we optimize our long-term vitality. The dominant theme in 2026 is the shift from tracking to acting. Earlier, health tech focused on summarizing data. In 2026, Agentic AI takes action, automatically booking a doctor's appointment when biometrics skew. It adjusts grocery orders based on glucose spikes. It modifies digital physical therapy plans in real time. The cyborg aesthetic of early wearables is out. Jewelry is in. Devices have shrunk to become indistinguishable from fashion. Smart rings and skin tone patches remove the friction of wearing bulky sensors 24/7. Blood glucose control has graduated from a diabetic necessity to a mass-market performance metric. It is viewed as the control panel for energy, longevity, and weight management. The explosion of weight loss drugs created a massive need for companion care. Digital clinics manage the lifestyle alongside the prescription to prevent muscle loss and ensure long-term success. The new unicorn companies did not merely fill existing gaps, they created entirely new categories of consumer behavior by addressing latent needs. Oura has transformed the simple utility of waking up, replacing the legacy need for an alarm clock with the sleep performance economy. Consumers now strive to optimize their daily readiness score to enhance their performance in both work and life. Similarly, Levels has shifted the focus from the medical necessity of insulin for diabetes management. They cater to users who want to visualize how specific foods impact their unique biology to prevent energy crashes. In the realm of pain management, Hinge Health has disrupted the traditional path of surgery and opioids. They established digital musculoskeletal (MSK) care, meeting the new consumer desire to fix back and joint pain from home. Using sensors and coaching, consumers can now manage their pain effectively. Finally, Ro has modernized the pharmacy experience. They moved away from the physical drive to the store to a direct-to-patient (DTP) care model. This satisfies the demand for judgment-free, end-to-end diagnosis and medication delivery right to the doorstep. 3 years ago, only a doctor could interpret your health status. Today, millions possess this data on their phones, shifting the power dynamic. Patients now enter clinics telling doctors what is wrong based on weeks of longitudinal data. Employers have massively adopted these platforms as a cost-saving measure. Society has moved from health insurance pays for surgery to companies pay for prevention. Clinical studies from Hinge Health have shown up to a 56% reduction in elective spinal and joint surgeries for their members. Hustle culture has been replaced by performance culture, with high sleep scores becoming a social flex. Companies like Levels have forced big food to be transparent. With consumers able to see sugar spikes from healthy products in real time, manufacturers are being forced to reformulate products to be metabolically friendly. The leader in the invisible data market, Oura realized smartwatches were too intrusive for 24/7 wear. By shrinking tech into a titanium ring, they captured the sleep market. In 2026, they have pivoted heavily into women's health. This includes cycle tracking and pregnancy insights. They also introduce symptom radar, predicting sickness before symptoms appear. Oura is evolving from a tracker into an early warning system. Levels established itself as a pioneer in the field of food transparency. They took continuous glucose monitors and turned them into a consumer status symbol. Levels caters to the desire for hyper-personalized nutrition. In 2026, they have integrated with food as medicine trends. They auto-suggest meals that keep glucose flat. Levels effectively acts as an automated nutritionist. Hinge Health tackles the opioid and chronic pain crisis. They mail patients tablets and wearable sensors for at-home physical therapy. Hinge Health meets the consumer need for pain relief without invasive procedures. Their 2026 strategy focuses on whole body movement. They use computer vision to correct posture and form for preventative care. This targets office workers before injury occurs. Ro originally focused on men's health. They realized the universal need for judgment-free care. Ro caters to patients feeling alienated by traditional clinics. This includes issues like obesity or sexual health. In 2026, Ro has become a dominant player in the obesity epidemic. Ro has solidified its position as a major provider in obesity care by integrating prescription GLP-1 medications into its structured Ro Body program. Moving beyond just injections, Ro has launched the new Wegovy pill as a key direct-to-patient partner. The trajectory of specialized health and metabolic monitoring in 2026 represents a fundamental rewriting of the healthcare contract. We have moved past the era of intermittent reactive care into an age of continuous proactive intelligence. Companies like Oura, Levels, Hinge Health, and Ro have successfully shifted the locus of control from the hospital to the home. By making health data visible, actionable, and seamless, they have empowered individuals to act as the CEOs of their own biology. Ultimately, these technologies have transformed healthcare from a service visited when broken into a lifestyle lived to stay whole.